We have been on PracticeOne since 2005. We are a multi-specialty organization, so we've got 50+ providers across all the specialties. We're talking physical therapy, we have an ASC, family practice, ENTs, you name it, we've got it. So we needed a product that was going to be able to accommodate all of those specialties and not just have a hypertension template and that is all you're suited to document. So PracticeOne has been really great for us. We also have done a gradual rollout. We've worked with the super billing first, and then we moved into the prescription writing and actually did co-development with PracticeOne, which was a great experience. It gave us the ability to say, you know, this doesn't exactly behave the way that we want it to. Could we modify that a little bit? And that's something that we didn't get with the other competitors that we looked at. It was more of, this is your packaged product, this is what you're going to use. Whereas PracticeOne has been very receptive, even if it's just a small change, you know, with multiple specialties, multiple departments, maybe we need this. And so PracticeOne is a phone call away. You're not just a client number, and you get to know everybody. The support is awesome. If you've got a question, they're there. In a lot of the big time companies, once the sale is made, that's the most important part to the company, and you do become a number. With PracticeOne, you're able to call up, get a suggestion or an assistant, and it really helps to make our experience that much richer with the company. Going live, everybody likes progress, everybody hates change, so we definitely dealt with the champions. Yes, I want to do this, give this to me now. And we've dealt with the people who say, well, I'm not really ready for that. You want a computer in the exam room? Really? Why would I need that? I don't need that. I have my chart. And watching that development of people realizing that that paper chart is not as necessary as they may think it is. So that's been a huge change. We've seen a lot of progress in the offices. Doctors who are able to fill prescriptions without getting the chart. Offices that can see patients the day of their appointment without pulling that chart. We're not doing point of care documentation yet, so there is still reliance on a paper chart, but we're finding that lessens the further that we get into the system. A couple of our hold-off people in family practice are two, you know, don't talk to me about this yet kind of people, on their go-live date actually said, why didn't you let me do this sooner? Patients have been very positive about the whole experience. With the computer in each exam room, the monitors are angled so that the patient can see their chart with the physician, or it can be turned away from them if they need to look at something, just the physician. Patients then get to interact with like their medication list or their problem list. What is that? No, that's not how I take that, and they really like that. At the end of visits, we tend to print out a medication list for our patients. You know, here is everything that we have you on. Please let us know if there's any changes. If we're referring them to another physician, maybe a cardiologist for a possible stent or something, we'll give them a couple copies of their med list and say, take this to the anesthesiology interview, take this to the cardiologist, and that way everybody's on the same page. So it's really helped with continuity of care. We also had a patient who was given a copy of his med list, had gone home within a few days, had some chest pain, went to the emergency room. When the papers came back from the emergency room, they had, your patient was here for chest pain, all of the information. There was a copy of the med list in that paperwork that they sent back to us. It was our med list, but we had sent that with the patient just as a precaution. If you ever need a copy of your med list, here it is, and he used that.